we have landed on a vaccine certificate policy that is based on evidence and best advice. It's a policy with the following key principles. Vaccinations will be mandatory for certain indoor settings where the risk of transmission is highest because of masks aren't always worn, including restaurants, bars, and casinos, among others. Enforcement will be led by law officers, will be reasonable, and will rely on individuals and businesses to do the right thing. The policy will not apply to outdoor spaces where we know the risk of spreading COVID is low, except for nightclubs because of the higher risk of these settings. We will accommodate legitimate medical exemptions and will be closely aligned with other provinces that have introduced similar policies while ensuring we design and implement a policy that makes sense for Ontario. These measures will be in place as of September 22nd, and they are intended with one goal in mind, to allow Ontario to keep moving forward safely, to protect our hard-fought progress. And my friends, it's no secret. This is something that I did not want to do. This is a serious step that we're not taking lightly, and I know this is going to be very difficult for some people. And let me be clear, this is a temporary tool that we won't use for a day longer than we have to. But after talking to Dr. Moore, I know that this is what we have to do right now in the face of this fourth wave, because these certificates are necessary to keep our hospitals safe and to avoid another lockdown. This is the right decision for our kids, our businesses, and for all Ontarians. Before I pass it over to Minister Elliott, I want to implore all Ontarians who are not fully vaccinated to do so without delay. These vaccines are safe, they're available, and they are your best protection against this virus. If you have questions, please talk to your doctor, your pharmacist, or primary care provider. Do it for yourself and for everyone else you care about. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier. Good afternoon, everyone. Throughout the pandemic, the health and safety of Ontarians has remained our top priority. We've taken a cautious approach to reopening and have taken measures to protect vulnerable Ontarians, including wide-ranging mandatory vaccination policies. We know vaccines provide the best protection against COVID-19 and the Delta variant, and we thank the over 76% of eligible Ontarians who have received both doses of the vaccine. And together with our health system partners, we are continuing our last mile strategy to administer even more first and second doses each day. However, the threat of COVID-19 and the Delta variant remains strong and will continue to pose a risk until we receive and achieve higher vaccination rates. Further action is required to protect Ontarians while they enjoy many activities that are now accessible, while continuing to keep our schools and businesses open and our economy running. That's why, as of September 22nd, Ontarians will need to provide proof of being fully vaccinated in order to access a number of businesses and public settings. This process will occur through two steps this fall. Beginning September 22nd, individuals will be required to show their vaccine receipt at the entrance of certain settings along with photo ID. These receipts are currently available as PDFs that can be downloaded or printed. Beginning October 22nd, we will introduce an enhanced vaccine certificate with a unique QR code. This can be kept on your phone to easily and conveniently show that you've been vaccinated when needed. The province will also launch a new app to make it easier for businesses to verify your digital vaccine receipt while protecting your privacy. Our approach will focus on indoor settings with restrictions, including those where there are larger numbers of people and where face coverings can't always be worn. This includes restaurants, bars and nightclubs, gyms, meeting and event spaces, and indoor sporting events. But I want to be clear that at no time will people be denied medical care, food from grocery stores, or basic medical supplies based on their vaccination status. We will also maintain access to these settings to those who have a medical exemption or children who are not yet eligible to receive the vaccine. Our government will not hesitate to protect Ontarians' health and well-being, and this initiative will help manage the fourth wave while also keeping our schools and businesses open. Increasing vaccination rates is the path forward out of this pandemic. So please, if you haven't already done so, get your first and second dose of the vaccine as soon as possible to protect yourself, your loved ones, and your communities. Thank you, and I will now pass it over to Dr. Moore.
Thank you, Minister Elliott. Good afternoon, everyone. Like many other jurisdictions, Ontario is in the midst of the fourth wave of the COVID-19 pandemic. We've seen an increasing number of cases and hospitalizations due to COVID-19, especially amongst those who are not vaccinated. By taking a cautious approach to Ontario's reopening, we've been able to slow the growth of the virus, but it is critical that we continue to respond with assertive action to protect Ontarians from serious illness, hospitalization, and sadly, death. We need to be proactive to avoid reactive closures, and that means looking at best evidence and practices to maintain a strong chain of protection. Proof of vaccination is one such practice that is increasingly being adopted in other jurisdictions to help limit the spread of the virus. British Columbia, Manitoba, and Quebec have all started to implement vaccine credential systems. As we continue our last mile strategy to increase vaccination rates, the introduction of a proof of vaccination policy will help to encourage every eligible Ontarian to get their shot, to keep our communities safe and the province open. Immunization is key to protecting ourselves, our loved ones, and our most vulnerable. And Ontario has developed the most comprehensive and far-ranging vaccination policies in the country. This includes the directive issued on August 17th, mandating vaccination policies in high-risk settings to protect vulnerable patients and staff. We are providing third doses of the COVID-19 vaccine to vulnerable population and have expanded eligibility for the Pfizer vaccine to children born in 2009 or earlier. The province and public health units are implementing many community-based strategies to make the vaccine more conveniently available to every eligible Ontarian. And we will also continue to implement vaccination policies in other congregate, post-secondary, and childcare settings so that every link in our chain of protection is strong. Ontario has one of the highest vaccination rates in the world, and this is key to protecting Ontarians against COVID-19 and the more transmissible Delta variant. But we need to do more. The months ahead will be challenging, and it is vital that everyone eligible to receive both doses of a COVID-19 vaccine do so. A large majority of reported cases, hospitalizations, and death from COVID-19 are in unvaccinated or partially vaccinated people. I am strongly encouraging Ontarians who have not gotten vaccinated to protect themselves and their loved ones. Please roll up your sleeve and please get vaccinated now. Thank you.
We'll go to the phone line for questions. First question, please.
Adrienne Gabriel at CTTV.
Hi, how you doing?
Good afternoon. Question for Premier Ford. Today Quebec announced the beginning of their vaccination plan. They have their QR code. It's all set up. Mm-hmm. You were hesitant to do this for months.
Yep.
Why now? And what do you say to the people of Ontario who are frustrated that it's taken this long and they're going to have to wait until October 22nd to get a QR code?
It's September 22nd. Well, let me just answer your question. There's no secret that, I wasn't in favor of this. Matter of fact, I stood there a while back and saying I wasn't in favor of it. After sitting down with Dr. Moore, after finding out that the federal government just 3 weeks ago, said they weren't going to have a national passport. Instead, they decided to go with an unnecessary election. We're going to move forward with this, and we have some of the most cautious protocols in the entire country, in North America. As Dr. Moore said, we've been working hard, and I want to thank the people of Ontario. I want to thank the frontline healthcare workers. We have some of the highest vaccination rates in the entire world. We continued to have masking policies that other provinces, be it BC and Alberta, BC has 300 times more cases, or 3 times as well, 6 times in Alberta, which equals 600% more cases than we do. So again, I think we've, as a people of Ontario and healthcare workers, have done an incredible job, and we're going to continue doing it and taking every single caution we can to make sure that we have hospital capacity, that we don't have to shut down the economy. We make sure our kids are back in school, make sure the students in colleges and universities are safe, and we're going to do that at all cost.
Follow-up?
Yeah, to clarify, yes, the program begins September 22nd, but the QR codes won't be ready until October 22nd. My follow-up question is this. There's a long list of businesses that are exempt. Salons, retail stores, places of worship, youth sport venues. Mm-hmm. Why leave so many places off the list if one of the reasons for this vaccine certificate is to keep businesses open?
I'll pass that over to Dr. Moore.
I'd like to emphasize that we're trying to be as evidence-based as possible. We're following the data currently available to us in Ontario. I've had regular conversations with medical officers of health in York, in Hamilton, in Windsor, and in Toronto. The venues that we have chosen are responsive to the risk that we've found in Ontario. If the risk increases in other venues, we can and add and implement additional measures to protect Ontarians. But this is very responsive, very data-driven, and is based on the risks that currently exist in Ontario, with good feedback from all of the medical officers of health in high-risk jurisdictions where outbreaks are currently occurring.
Next question.
From Lorenda Redekop at CBC News.
Hi there. Thanks for taking our
Lauren.
questions. First off, on schools, the date that these passports come into effect is weeks after kids go back to school. Why aren't you doing more to prevent community spread to those who can't get vaccinated, knowing that cases are mounting and that we're now in a 4th wave?
Well, we're doing everything we possibly can. Our vaccination rates are, again, one of the highest in the world, highest in Canada and North America. Getting back to school is important. Minister Lecce's done an incredible job making sure we have proper ventilation. We have HEPA filters right across the school system. Increased cleaning. He's done an incredible job, and I have all the confidence in the world in our teachers, our principals, vice principals. They did it last time. We need the kids back in school. We cannot afford to go backwards. We cannot afford to have online classes. The kids need social interaction when it comes to going back to school, and we're going to continue making sure the protocols are in place, that we have a safe environment, not only for the educators, but especially for our teachers.
Follow-up?
You had said, and we've also heard from your ministers, that the current system in place to show proof was good enough. Now you are bringing in this QR code, something that we'd heard from many people, them saying that it was necessary. What convinced you that, yes, this was needed?
Well, I'll go back to months. All the premiers, every premier wanted a vaccine passport. And unfortunately, the federal government decided to go to an unnecessary election, which I'm still shaking my head over, in the middle of a 4th wave and a pandemic, and then telling us just 3 weeks ago that they wouldn't be able to get it done till the 24th. sat down, had a lot of great discussions with our medical professionals, specifically Dr. Moore, and I've always said from the beginning of this pandemic, I follow the medical advice of the Chief Medical Officer and the science, and we haven't wavered from that. And we have two options here. We either do this or we risk shutting down the economy, which would even be worse, having our hospital capacity maxed out and at the brink, having our kids stay at home, our colleges and university kids going back online. That's what we're trying to avoid. And I'm taking the advice of the Chief Medical Officer, as I always have, and we're moving forward when we found out that the federal government could not implement this like every other country and every other leader in the world is doing this. So when you're traveling, imagine traveling around, even Canada, with 13 different vaccination certificates. It would have been much easier if we had one passport, federal passport, we could utilize for traveling, utilize for going into, be it restaurants or other areas. That never happened. We've stepped up, and we're going to make this happen and move forward.
Next question.
From Colin DeMello at CTV News.
Hi, Colin.
Hello, good afternoon. My first question is to the Chief Medical Officer of Health. Hi, Dr. Moore. You had said earlier in the summer that you were expecting a rise in cases in the third week of September after students return to school, but that acceleration seems to have started well before. It already started in August and it's continuing to build. So what are you projecting for September after kids return to school and colleges and universities, and how much of an increase are you expecting from where we are today?
Some of the good news is, Colin, that the number of days for this virus to double is actually increasing. So it was getting shortened down to around 21 days. If you look at the science table data today, it's up to 30 days. So the measures that we've been putting in place that Ontarians are following of masking and hand hygiene and testing and outbreak management are working for us. The policies that we put in play to best protect our colleges and universities, and I wrote a letter of instruction to ensure that all of our colleges and universities in Ontario had immunization policies in play. The vast majority of those colleges and universities have adopted mandatory immunization. That makes those environments safer. We've also worked diligently all summer long with Ministry of Education to ensure we have a safe return of our students. So all of this, we had a heightened risk just a few weeks ago. It's plateauing out, and we'll have to watch as students return. It's not necessarily students in the classroom. I truly do believe we have increased the safety of the classroom through all of the investments we've made over the last several months, and all of the best practices that we've kept in place as compared to other jurisdictions, and the masking that we're going to have, and the testing capacity that we've built. All of those will, I think, ensure a safe reopening, but we're going to monitor that data as colleges go back, universities go back, and students go back, and then make decisions further with government on further reopening. But as you're anticipating, we are putting policies in play, anticipating the risk, and best protecting Ontarians every step of this way, and the government is supporting data-based decision-making.
Follow-up?
Thank you. My next question is to Premier Ford. Hey, Premier, hope you're feeling safe without journalists in the room. We know through our friends at the Toronto Star and the Globe and Mail that you've essentially entered into a non-aggression pact with the federal Liberal leader Justin Trudeau, and that cabinet ministers are forbidden from campaigning for Conservative leader Erin O'Toole. Today, though, you've said a couple of times now that this election is unnecessary. Are you jumping off the sidelines here? Are you getting involved in the federal election?
Yeah, no, I'm not getting involved in the federal election. I have my hands full here. I'm focusing on making sure that we get through this pandemic, making sure that this virus, the Delta virus, we're dealing with the best way we can. And I just want to make sure that we move forward. And you know, I think I've proved to people around Canada and Ontario, I'll work with anyone. I don't care if it's the Liberals, Conservatives, whoever ends up becoming the Prime Minister, I'll be able to work with them.
Next question.
From Rob Ferguson at the Toronto Star.
Hi, Rob.
Please unmute.
Hi, Premier.
Rob.
Sorry, I was slow on getting my phone unmuted. Just wondering what you would say to people who are kind of on the front lines at restaurants, at bars, at nightclubs, at Jays games or whatever, concerts, who have to go over these vax printed out or downloaded certificates and have to calculate whether the people are 2 weeks past their second shot to make sure they qualify to get in. What advice do you have for them? Because there's probably going to be contentious situations where these people might actually have to act like bouncers.
Yeah, no, I hear you, Rob, and that's a great question. We're really relying on the people of Ontario. They've done an incredible job. We have to unite. We have to unite as a province, and I know this isn't easy. Believe me, I know. I'm getting calls and messages and talking to people around the province. This is very, very difficult, but we have two options here. We either continue to move forward in a responsible and very reasonable way, and be proactive, by the way, or if we aren't proactive and we don't take these steps, nothing's worse than shutting down the entire economy, and we're going to do everything we can to make sure that doesn't happen. Making sure that the kids are back in school, making sure our hospital capacity can handle the new cases. I rely on the modeling, I rely on the chief medical officer, and that's the advice I'm getting, and we're going to be very cautious. We want to get through this. I do not want this to go a day longer than we have to, but we have to see what happens when everyone gets back to work, when the kids in colleges and universities get back and the students are back in school. But folks, I know it's difficult, but we have to unite the province, and we will get through this.
Follow-up?
Yes, thanks for that, Premier. And maybe if you don't want to field this next one, I'm welcome to hear from Dr. Moore or Elliott. People who are enforcing this at the gate or...
Rob, we're having some trouble hearing
breaking
you.
up a little bit. Can you try that again, Rob?
Rob, can you ask your question one more time, please?
Sorry, what should people do in a practical sense if they're manning the gates at a Jays game or a restaurant and they do get into a hassle with someone? Should they just call the police? I think I heard you mention earlier perhaps by law enforcement. So what's the solution there? Because it is going to happen.
I know, and I just don't want it to happen. I don't. If people want to get angry, they want to protest, come down to Queen's Park. They can protest, they can do cartwheels, do whatever they want down here. But please, these people are just trying to earn a living. They're just trying to do their job. You know what's so sad about this whole situation, Rob? This virus, it has split up friendships. It has divided coworkers. It has divided families. That's the hardest thing I deal with. It's heart-wrenching. And we need to stay united. United, we're a lot stronger than we are when we're divided. And maybe Dr. Moore, if you want to add anything to that.
No, Premier, I think that's wise advice to Ontarians. We have to stay kind and caring and compassionate. I think the vast majority of Ontarians are following all the rules. 83% of us who are eligible have had our first doses. The vast majority of people are going to be very compliant. There's always a 1 or 2% that'll be noisy. We're trying to avoid confrontation. We're trying to be reasonable and prudent. I believe this will be implemented fairly quickly and efficiently, and we'll move on to the QR code so there won't be those types of one-to-one interactions. So there will be a transition time that could be difficult, but I do believe the vast majority of us won't have an issue with this. We'll be kind and caring and compassionate, and we'll do all the things we've done in the last year and a half. Continue to get tested if we have symptoms, continue to wear our masks, continue to wash our hands, and continue to protect one another.
Next question.
From Holly Mackenzie-Suter at the Canadian Press.
Hi, Premier. This question is
Holly.
for you and maybe Dr. Moore if you want to answer. I understand that these vaccine certificate rules don't apply to staff in the new venues, but it's still a stricter policy than what applies to long-term care homes and schools where unvaccinated people can take a test to attend. So can you just explain why an unvaccinated person can work every day in a long-term care home but won't be allowed into a nightclub. Like, why are the rules more strict in these non-essential settings?
Well, thanks so much for that, Holly. I better hand it over to Dr. Moore with that one. Thank you.
So our initial instruction from the Minister of Long-Term Care was instruction on be vaccinated or medical exemption or education or test. That instruction will be opened in that if there's a risk assessment that they haven't achieved the vaccination record or rate amongst their workers that they want, that they can expand it to a mandatory. As you've heard, many hospitals have done that same risk assessment for children's hospitals that serve children that can't be immunized. They have mandated immunization. So we have had a progressive approach to immunization policies in this province, some of the strongest in the world, and we will move to mandatory if and when we're not achieving the goals that we want to protect patients, children, and vulnerables in our community.
Follow-up?
Yeah, thanks for that. Follow-up just for Premier Ford. I mean, this is the first time we've heard you take questions from the media in over a month, and just wondering if this does have anything to do with the federal election or not wanting to impact the federal Conservative campaign. Just wondering if you can address that and kind of why not take questions in so long when there's a lot going on in the province with the COVID.
Yeah, and thanks for that, Holly. You know, I've been working day in and day out like everyone else has, and I went to northwestern Ontario. I know I always want to say Ontario doesn't end at the 416 border. I traveled 1,800 kilometers by car, not by plane. We flew into Thunder Bay, and then we got in the car and we went all over northwestern Ontario. You know, these people need to be heard as well. I was out there meeting just endless amounts of people, taking tours of different areas, and all the way up to Atikokan, to Fort Francis, to Thunder Bay. I went to Alstom, a few other places, went to numerous First Nations communities to discuss what we can do there to support them. And by the way, I'm giving the First Nations communities that hosted us a big shout out. Thank you. They treated us like gold, and I'm very, very grateful, and will always be there for them and have their backs as well. But again, it's about coming together, uniting, making sure we don't forget about anyone. I'm going to continue to go out to the whole region of Ontario. People don't realize until you've traveled how large Ontario is. I was at the end of Yonge Street, and then up there they call it the beginning of Yonge Street, over 1,800 kilometers, and just talking to people, telling them that they aren't forgotten. And I'm going to continue to travel to the southwest, over in the east, and everywhere I possibly can to make sure we're there and listen to the people on the ground. There's two things that you can do, Holly, when you're an elected official. You can either sit in the bubble down here, I call it the bubble, listen to a bunch of politicians or Ontario provincial staff, and not give your number to anyone. We've taken a different approach, our family has. I give my phone number to everyone. This phone rings nonstop from people that agree and disagree. I try to get back to as many people as possible. You have thousands of years around the province, and you have better insight. And I'm just strong believer of getting out there and talking to the people. That's what I'm going to continue to do, no matter if they agree or disagree.
Next question.
From Richard Southern at 680 News.
Hi, Richard.
Hi, Premier. Good afternoon. Thanks for taking my call. I know Holly touched on this, but I didn't get a clear answer. I'm hoping you can address it, Premier, because I think it's an important point. This program you're announcing today will ensure that if I go out to dinner, everybody at my table and the tables around me are vaccinated, but the server that's bringing my dinner to me may not be. Can you tell us why you're not mandating a proof of vaccination for employees, but you are for patrons?
Yeah, excellent question, Richard. I asked the exact same thing. I'm going to pass it over to Dr. Moore and his ideas and philosophy on that.
So any business can introduce an immunization policy for their business and for their employees. And in certain circumstances in Ontario, we have mandated that as a letter of instruction, especially for those that provide healthcare services, but we've also done it now for colleges and universities. The other piece of protection that you have within a restaurant, for example, is that every worker should be screening for symptoms before they show up. They should get tested if they develop any symptoms. They should have the appropriate infection prevention and control equipment to protect them against any transmission of infection. And so there's a whole suite of tools that are there to protect the worker, although obviously my goal would be that they are immunized. If they choose not to be, they are still protected through all those other mechanisms.
Follow-up?
Premier, you kept barbers and salons closed for the better part of 7 months because you were worried about the possible infections there, yet they're not included on this list. In addition to that, if I may, on a two-part follow-up here, you brought up what you called an unnecessary federal election twice today when asked about vaccine certificates. What exactly does the federal election have to do with what's being announced today, sir?
I'll answer that first, then I'll go to the barbers and hairdressers, then I'll pass it to Dr. Moore. The federal election, again, all the provinces, all the premiers have requested a national vaccine passport. It's a lot easier, standardize the system, and then we can utilize that right across the board, no matter if we're traveling abroad or going into a restaurant. It's just so much easier. They neglected to do that. Like other governments around the world, they have a national passport. Then they decided to call the election an unnecessary election at the worst time, in my opinion. You don't call the election during a fourth wave. In saying that, they've done it. Now all the provinces are stepping up, and we're putting together our vaccine certificate. And as for barbers and hair salons, there's no one that got hurt more along with them, many companies, but especially barbers and hairdressers got hurt a lot throughout this whole pandemic. Things were different 3 months ago. Now we have 83% and growing people vaccinated on their first dose. We have, I believe, close to 76, 77% of the first doses every single day. I get the sheets that show who's been vaccinated. I'm so happy when I see the first vaccinations are continuing at a rate from 10 to 12,000 every single day. I think close to 30,000 people got vaccinated yesterday. And again, we wouldn't be in this position if it wasn't for the people of Ontario going out there and getting vaccinated. And we wouldn't be here for the healthcare workers that have just worked day in and day out. They're exhausted. And I just want to give them a shout out. I want to thank them, along with healthcare workers. I put them in the same category, the firefighters, the paramedics, police officers, emergency services. They've done an incredible job. And Dr. Moore, go ahead. Sorry. About the
good question in the personal service sector. We've done a risk assessment of that sector at present. They've got very good infection prevention control practices, both for their workers and for their clients, and their screening that's in place, and their smaller settings. Our biggest concern now going forward with Delta is the high transmissibility and high virulence of it, especially in gatherings where there's large numbers of people. That's where you can have explosive outbreaks. So our risk assessment at present is the bars, the restaurants, the gyms, where we currently are having outbreaks in Ontario. We have strong evidence that we need to have policies in place to protect those environments, to minimize the impact both on the businesses and on individuals by having this policy in play. We will continue to do risk assessments of all of these venues across Ontario in the coming weeks and months, and can expand the list. But at present, we're following data, we're following evidence, and we're putting the policies in place to best protect Ontarians. But we will be relentless in protecting Ontarians going forward, and I certainly hope anyone working the personal service setting will be immunized given that environment.
Last question.
From Jeff Gray at the Globe and Mail.
Thanks very much. Hi, Premier.
Hi,
I wanted to ask you just, we understand that there was an initial proposal that you had objections to, and the proposal was revised. Can you tell us anything about what was it that you were concerned about with what was initially put forward?
Well, with any proposal throughout this whole pandemic that's come from our provincial staff and our health experts. We always tweak it, we talk about it, and we want to simplify it. We just wanted to make sure it's very easy to get done. We wanted to simplify it, and some folks are probably wondering who this good-looking gentleman at the end, he's Minister Khalid Rashid, that again is the Minister of Digital Government. He's done an incredible job, and this just doesn't happen overnight. I'm not the techie guy. Khalid worked for BlackBerry, very, very smart individual, and has done an incredible job. I'll pass it over to Minister Rashid, and maybe he can talk a little bit about the program that he's put together.
Perfect. Thank you so much, Premier. And absolutely, this program that we are launching, especially the QR code and the app, the provincially designed app, is going to be a very secured and a very privacy protected app. And this will allow users to eventually, businesses to use this app to look at the QR codes and scan individuals to gain them access to their premises. And I think provincially, the team at Ontario Digital Services have been doing a phenomenal job. My team has been working around the clock to make sure that we have a solid product by October 22nd, ready to go.
Follow-up?
So just to clarify, there weren't areas, businesses, types of businesses that Dr. Moore or other health officials had recommended should come under this policy that you or other ministers, cabinet ministers, decided should be exempt. Is that right?
That's correct. We just wanted to, again, make it standardized and simplified as possible, and that's what we did. But this isn't uncommon for any policy. You get everyone to look at it, other ministers, cabinet caucus. You get the people within each department to look at it, and you tweak it and try to make it as easy as possible to get done. And we just want to move forward on this. And I know this is tough, believe me. It is very, very tough. But it's something necessary that we have to do. We have to make sure at all cost, no shutdowns, make sure our schools stay open, and make sure our hospital capacity can handle any influx that we see. And by the way, I'm going to give my right-hand person a real shout-out, Minister Christine Elliott, that's been shoulder to shoulder with me from day one, working her back off around the clock, making sure that the hospital capacity and ICU is increased. She's done an incredible job since the beginning of this pandemic, and I'm so grateful for her hard work, diligent work, and with her leadership, we're really doing a pretty good job getting through this.
Thanks, everyone.
Thank you, everyone. Stay safe, get vaccinated. Thank you.